Hello everybody. I am going to go through some ergonomics today. It's going to revolve around our pelvis, our chairs, and I have this little guy. I named him Fred a long time ago, and I will be utilizing his demonstration skills. First, I just wanted to say there's a lot of people out there who sit for a living. There's a lot of people who stand and walk for a living. This piece that we're going to talk about today is for the chronic desk sitters. Those people sit a lot. Many occupations, you know who you are. When we look at sitting, there's a lot of components that come along with it, so we're just going to start with the chair. So the chair typically is the number one component that's going to help or hinder our spines, our pelvis, and all the muscles surrounding them, right? So it can cause fatigue during the day, it can cause pain during the day, it can cause pain throughout the evening into the night, tension headaches, sometimes even bowel and bladder incontinence. So we're looking at all the women who've had babies. If there's any kind of issues with that, when we sit on a normal chair, that can inhibit those muscles from coming back to life after a slip and a fall, after giving birth, after having a seated job for our whole lives, right? Any of those things, trauma, any of those things can stop or inhibit our muscles in our undercarriage, we'll just call them that, from being what they should be, from being strong, from being resilient, from being equal side to side, front to back. There's many different things that a chair can do, and that's the start of today's lesson, I guess you would call it. So a lot of times when I see patients and they sit for a long time, we take time and we go over all of these things. I'm going to try to make this short and sweet, but it is a very important thing. And if we can adjust one or two of these components 10 to 50% every day, every week, you can make a drastic change. So you want to change how your back feels, how your migraines or tension headaches feel, your energy throughout the day, then listen in. Okay, so right here, this is called a saddle seat. I don't know if you can see it. This is basically what you might see at your nail salon, nail techs. Maybe you look and you see some of your dental hygienists will use them. It's called a saddle seat or a saddle chair. Very ergonomic. It puts your pelvis right where it needs to be. There's other chairs that can help with the back and push your spine forward. And what that does is basically goes around your chair, right? So you have a normal chair. You put it on the back and it creates like that hump, right? And that hump will support this low back, right? So it's supposed to come in and help support here, which then pushes our pelvis forward. So I'm just going to go over the normal ergonomic to why that's important. This is our spine, right? So our head would be here. This is Fred's head. It's gone. Here's the cervical spine, into the thoracic spine, and down into the lumbar spine. Then we have our ilia, right? So we have the right and the left hip, and they have two joints in the back that sit on your sacrum, one here and one here. But we also have a bone in the front, I should say, a joint in the front called the pubic symphysis. I believe that's hyaline cartilage. I'd have to double check. It's been a while since I looked at what type of cartilage. That's for another lesson. But these three joints down here are extremely important for our back. We have a lot of muscles that come through the pelvis and attach to the back called the iliopsoas. Then they come down and attach to the femur. We have things in our pelvic floor, our inlet here. These were the undercarriage muscles that I was talking about before, right? So when these muscles become inhibited, we can see incontinence where you have bladder leakage. We can also see that you might have pain in your tailbone. So our tailbone is this little guy right here. So when we sit on a chair, typically what happens is we lean back. Then our body comes forward and we're not seated properly on our sits muscles, or our sits bones, I should call them. So this bone on our pelvis, on the bottom part of it, this isn't where we should naturally sit, but we do. We come to this part, and this is where we should sit. So let me back up. When we are seated on a normal chair where our backrest goes, our pelvis tilts posteriorly. So our butt is back here, okay? And our back leans into the chair and it tilts our pelvis. What that does is it puts pressure in areas that it shouldn't be, and it makes our psoas have to contract to keep stability in our pelvis. Now when you sit in a saddle chair like the one behind me that hopefully I'll sit on and I won't fall over, it brings your pelvis and your spine into a normal seated position, bringing the pressure right onto our pubic symphysis here, right, instead of our sits bones in the back. So when I sit on the saddle seat, my pubic symphysis, let's see, it goes forward, right? And our spine then has proper pressure the whole way, all the way to our head, right? So my head should be balanced all the way down because my pelvis is right where it should be, and the pressure going all the way up my body should be equal on my joints, my facet joints, and also on our discs. So the reason why that's important is if that's equal in pressure, then the muscles in the front, the muscles in the back, and side to side should all be equally used. The importance to this is that it allows us to engage our pelvic floor, right, our undercarriage. And when we can do that, if we have pain in our lumbar spine, in our tailbone, in our pubic symphysis, in all of these areas, that will allow that to tighten and strengthen the way it should, and also to relax all at the same time, because there's not going to be the tension on it. So that's how you ergonomically sit in a saddle chair. It pushes you forward. But let's talk about when you sit in a normal chair. When you sit in a normal chair, I'm going to go backwards here. When we sit in a normal chair, you sit down, right? And you lean back or you lean to the side, because usually you have a rest. Or some of us will lean on our chair or lean on our chair because we have the mouse. And if you're right-handed, that's a common way. It would be opposite if you're left-handed. So let's just put a scenario. Let's add a crossing of our leg, right? This is the best way you can cross your leg. This is probably the worst way, but what people don't understand is crossing at the ankle is also not good and crosses our hips, and it does the same thing to our pelvis. And so when we're looking at sitting in a chair, all these things, because we get tired, right? You're sitting there for 8 hours, or maybe 2 hours, you get up for a second, 2 more hours, you get up for lunch, 2 more hours, you know, so you get this 6 to 10 hour day going every day of the week, and your pelvis is crunched, right? So I just dealt with a patient who unfortunately ended up doing just that, getting a chronically tight psoas from sitting for too long and being tense, and maybe, you know, you're knocking your foot, and maybe you're crossing your leg, and all the pelvis is screaming is, can you just let me be in neutral spine? So when we sit on a chair and our back goes, you know, it rounds it out, so the curve this curve goes away, the pelvis comes back, the tension comes on the muscles, that tightens, and when you go to stand up like this, those muscles say, nope, we're not going to do that. And you'll see people, or experience it yourself, is your pelvis gets stuck in a position, and you have to kind of walk out of it to stand up straight. So when you get a seat, the proper way to do it, because not all of us are going to go change our seats, but the proper way to sit on a chair is to sit forward, sit with both feet equally on the ground. It should be where your knees are equal to your shoulders, and you sit up straight. So what that means is you tilt your pelvis so that you sit. You tilt your pelvis so you sit right here on the sits bone, on the pubic symphysis, right? So you come forward, and it's almost like your pubic bone sits on the chair. And when you do this, that lengthens all of these muscles that get tight over time. That allows the undercarriage to really house what it's supposed to, which alleviates pain both in our lumbar region, right, in our low back, either on the posterior or anterior side. It can help for the chronic hip pain, right, down into the femur, into the leg, and also any kind of tailbone issue. A lot of people are like, oh, my tailbone goes numb, or my butt goes numb, or this is hurting when I'm working all day long, and then it just progresses. So when we sit in a chair, both feet on the ground, knees separate, about shoulder width apart, feet on the ground. If you need to move your chair up or down to make that a tabletop, that is important. And then you sit up. When you do that, you can't lean very easily to the other side. You can't get into that relaxed position until you tilt your pelvis. If you tilt your pelvis, it does the same thing over and over, and you'll go, oh. And as soon as you do that, you can breathe, right? So your diaphragm releases pressure, your ribs open up, your upper back then is released because you're not crunched over because your pelvis is tilted the wrong way. So let's recap. You sit on a chair. You try to get your legs at tabletop, feet on the ground, shoulder width apart, pelvis forward where your pubic bone sits on the chair, and that makes you sit up, okay? When you do that, you'll be able to breathe better, which brings oxygen to your brain and your fingertips and your feet. You'll be able to last longer sitting in this position, and you'll be able to get up and go to the bathroom, go eat your food without any issues, right? So those are the major key components to getting a good posture. It starts at the pelvis. When you're seated and you round your back and you shift your pelvis, everything else folds in and is super easy to get lazy, which causes issues everywhere. So straighten the pelvis up, pubic bone into the seat. That makes your spine relax and go erect. That puts proper pressure here all the way down to my butt. And when I do that, I can last longer. I can do more things. And that's why getting something like a saddle chair is going to be beneficial. That's why a lot of people will use a ball, right? A yoga ball. That is going to be hard at first, but eventually it'll help. I would just adjust accordingly. Start with sitting like this on your chair. If this becomes difficult, then order a saddle chair. If the saddle chair works, which sometimes there's pain with that. I mean, when I first got this chair and started sitting at my desk again, I did feel like I rode a bike. I mean, you're not used to sitting in that position. And so when you get used to it, no problem. I didn't have any problem in the past few weeks, which is amazing. So I might go get a yoga ball, which is the next step, because then not only is it core lengthening, it would be core strengthening. So you start with one step at a time. Now there's other things that we should address, but I won't go into major detail in, but that's getting in and out of a car and in and out of bed. So there's a lot of ways that we get into the car, okay? So it's gonna be funny, but here, let's see if I can animate it for you. All right, so here's my car. I open my door and I go like this and I sit in there, right? So let's just call this my car here, okay. Well, what happens? See how crooked I am? Okay, cool. So what do? Right? So the optimal situation is, well, I got to try to, well, none of us remember this. So instead, what you do is this. You open the door, you turn your butt, you sit, you bring your feet, you push on the floor, right? I couldn't because it's too tall, and you're seated, okay? So there's ergonomic things that you need to do that will allow you to not screw up your back coming in or out while you're making these changes. Because when you're seated in a car and you get in from the side position, oftentimes your hips are like this. And when your hips are like this, that really throws things off. And if you were to get into an accident like this, what happens to our structure? As opposed to if you're seated in a normal upright position where your pelvis is on the seat, right? A lot of people buy those circular back rollers and they stick them right here behind their back, which pushes their back forward, but they never address the hips and bring the pelvis forward with it. If you do both of those and you're sitting normal, your legs don't go numb in the car. You can sit and drive for a lot longer. When you get out, same thing with sitting all day long. So those are just tips to think about it. Same thing with getting in and out of bed. I'm not going to show you how to do that. There is a proper way to do that. And if you have back conditions and you end up in my office, I will. Super easy. A lot of you probably already do it already. But our ergonomics are what we do 8 to 12 hours a day, right? So a lot of times when patients come into my office, if we can correct or address ergonomics 25 to 50% of the day, it makes an astronomical change in your life. And so addressing these things might keep you out of my office. It might keep you out for a really long time or forever. I don't know. All of us have different things and different journeys that we go through. However, if you can take this ergonomic thing, adjust your daily life to it, 25% of your week, 25% of your day, take it as the first 2 hours of the day, I'm going to sit like this. That will change your week. That will change your day. That'll change your body. There's so many different things that it's amazing to see when people stop crossing their legs that they might not have a hip replacement. Or, I don't know, their hip replacement lasts for 15 years instead of 20. Crossing our legs puts chronic stress on our hips. You can work on not crossing them for more times than you are. Even adjusting 10 to 25% can change your low back pain or your hip pain or your leg length when your pants wear poorly on one side versus the other. So there's so many awesome things to do with ergonomics. We addressed a few here today, just about sitting. If you want to get more into all the ergonomics, there's a ton of literature on YouTube or movies. There's a lot of things that you can correct, but this is just something that I do here in my office with patients normally. So, free information. I want everybody to be able to have this information and benefit from it. Sorry, I was so serious today. I love ergonomics. Ergonomics is super awesome. So when you come into my clinic, I'm already watching you walk to see if there's discrepancies, a foot drop, a hinging, whatever that is, how you sit, right? How you use your hands like I do 24/7 day. Like, however that looks, those things are making you better or making you worse. Whatever that is, if we can look and assess and change, even percentage, 10, 25%, you'll actually change your life and any pain issues you might have. So, happy day. Have a wonderful day. And I hope to see you again sometime watching these videos, like, posting what questions you have or anything else. So, see you again. Have a good day. Okay, bye.